Hello, welcome to Optimum Health for All. I'm your host, OJ Odia.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
Today, we're going to talk about chronic kidney diseases. Chronic kidney diseases, CKD for short. And in the program today, we have Professor Solomon Kadiri, who is a consultant physician, nephrologist. And nephrologist persons who manage kidney disorders. Professor Kadiri, you are welcome.
Thank you.
Now we're
But
talking
maybe
about
just to remark that I actually retired last year. So,
yes, I'm retired also.
yes.
Basically, we are still
Uh-huh.
basically still a consultant
Yes.
nephrologist. Now, we're going to talk about chronic kidney diseases. The first thing I would like to know, Professor Kadiri, what are chronic kidney diseases? What are these conditions called CKD?
Yes, chronic kidney disease, I think would best be described as disease of the kidneys that's gone on for over 3 months. The other important thing to note about is that the patient may or may not be aware of the presence of the disease. In other words, the disease may be detected accidentally or incidentally on routine examination, but at other times, the kidney disease manifests with some symptoms, some signs, and sometimes not at all until some clinical tests, some tests are carried out. And indeed, that's one reason why chronic kidney disease is taking a big toll on patients. Some patients never get to know they have chronic kidney disease until the disease becomes advanced.
Are there any warning signs of maybe some features that somebody may notice that will suggest kidney disease?
Yeah, that's right. Sometimes it's nothing more than unusual tiredness, or feeling listless, or feeling tired, unable to carry on with the normal day-to-day activities. Sometimes you see that as lack of motivation, lack of drive, sometimes poor appetite, weight loss, and it might take a while for attention to be drawn to the likelihood of kidney disease.
So just general feeling of being
Unwell.
well, not really well, and they may not know exactly what it is.
That's right.
So it's important to visit hospital early.
Yes.
So once one gets to hospital, we'll see a doctor. What are the likely things that doctor may want to look at?
Okay.
When the tests to be done and all that.
Okay. Some of the commoner symptoms, when they are present, will be alterations in the urine, either an increase or a reduction in the volume of the urine, to be change in the color of the urine. Patient could, or the form of the urine. The urine could become excessively foamy, frothy, or indeed, the patient may complain of swelling of the face, swelling of the legs, swelling of the body. In other words, patients retaining excess fluids in the body. That's another way in which that could manifest.
So excess accumulation of fluids.
Yes, accumulation.
Maybe changes in the frequency of urine.
frequency of the urine.
Then the color of the urine, the appearance of the urine.
In the situations in which blood appears in the urine in significant amount, the urine could be colored red. That is not really the common way in which this might present. The urine, you made a point about the number of times one passes urine. If patients, particularly a young patient, finds that he's passing urine excessively at night, having to wake up so many times, more than 2 or 3 times at night to pass urine, he should have the urine and the kidneys examined, but that could be a kidney problem. The urine tends to be, in general, more dilute than in other people, because one of the functions of the kidney is to concentrate the urine. Those may be telltale signs. But perhaps the best advice would be that, I know it could be a problem in a place like Nigeria where health services are not that freely available. That if one notices any significant alteration in his general health, he should see a doctor.
So go early to see a doctor, get examined and things. So what are the common causes of chronic kidney disease? What are these common kidney disorders that may become chronic?
Okay, there are some large groups. And let me begin with this, although that's not to say that these are the commonest causes. One might have been born with some abnormalities of the kidney. The abnormalities were there even at birth. And with time, the passage of time, sometimes up to 2-3 decades, the kidney disease might not manifest until there is rather advanced damage to the kidney when the kidney disease manifests. And we call these congenital abnormalities, abnormalities which are present at birth. Then there are others. There could be primary disease of the kidney. In other words, the patient could acquire these diseases after birth. Could be various forms of inflammation of the kidney. 2 big groups would be glomerulonephritis, interstitial nephritis. These are medical terms, and but they basically describe inflammation of parts of the kidney. In other situations, the kidney disease could follow a disease elsewhere in the body. And good examples would include hypertension, diabetes, or just being excessively obese. And then some other diseases which are prevalent which are quite common in many parts of the world. Hemoglobinopathies, like sickle cell, may be complicated by chronic kidney disease. HIV, which is a problem, will be complicated by chronic kidney disease. And then various other infections, including malaria, which at one time was found to be a very common cause of kidney disease, although particularly in children. Although in more recent years, there hasn't been so much evidence in that direction. But I think the important thing to state is that the kidney disease may arise in the kidneys, or could be secondary, could follow a disease elsewhere in the body.
Okay. So this can there be?
That having said that, it would seem that there are so many more causes which have not clearly been discovered. Yes, because the rate at which the kidney disease is diagnosed in the country would seem to suggest that there are many other causes that have not been clearly identified.
So how come, say, the general population will be treated with disease?
There have been a few studies in Nigeria, with some of them given widely differing results, but it would seem that between 5 and 15% of adults in Nigeria may have one form of chronic kidney disease or the other. But that's not to say that the diseases are necessarily at an advanced stage. But as I mentioned, what one can have his urine tested, there could be some abnormalities. And if after 3 months, the abnormalities are still there, even one feels completely well, but the abnormalities are still there, that such patient may be said to have chronic kidney disease.
Still emphasizing the point of going to hospital early that it can be treated as. So, are there any treatment procedures for patients, as in general, patients who have this chronic kidney disease?
Like I mentioned earlier, that hypertension is a cause of chronic kidney disease. But I should also mention here that chronic kidney disease itself, of whatever cause, will lead to hypertension. So many patients with chronic kidney disease will develop hypertension. So the treatment of hypertension becomes paramount in that group of patients. The patients often have anemia. That's there, so to say,
Short of blood.
yes, short of blood. So treatment may be needed in that direction. And as mentioned earlier, they could retain fluids, so they may need medicines to get rid of the excess fluid in the body. And then other things. In more advanced stages, patients would vomit, and so that will be treated along the lines. There might come a time when treatment of these conditions, so to say, are not much relief to the patient, and that stage, patient with chronic kidney disease may need what we call dialysis or kidney transplantation.
Okay, so that kidney replacement,
Kidney
therapy. Okay. So it's something you have to do the work of the kidney for it, either through dialysis or changing the kidney altogether.
getting healthy kidneys from another.
Okay, so that's probably the early stage
Yes.
of so this can be done between early detection and say kidney transplant.
Oh yes.
A lot of this can be done
Yeah.
to correct based on the presentation and what is the cause of the kidney disease.
Yes.
Okay, so are there places in Nigeria where kidney dialysis are done? And if they are, how what is the cost like, the cost implication?
Okay. Now, unfortunately, when the patient reaches that stage you mentioned, end-stage kidneys, by definition, that patient is going to require dialysis or transplantation. And those will be the only effective forms of treating the patient. So if dialysis is the chosen option, in principle, that would be for the rest of the patient's life. That's very expensive. Patients ordinarily at that stage may require dialysis 2 or 3 times a week. And as I mentioned, that will be for an indefinite period. The cost varies from place to place, but dialysis is widely available in Nigeria. Most of the principal cities in Nigeria have dialysis centers. Some have multiple centers where dialysis can be given. I'm not too familiar with the cost in various places now, and I'm only surprised if the cost if the cost goes up to like 40,000 for a session, and as I mentioned, patient might require 2 or 3 of those sessions in a week. So you see that's a lot of money.
The insurance companies pay for dialysis. That's insurance company.
The National Health Insurance Scheme pays for acute dialysis, which is not really the mainstream of treating chronic kidney disease. I say that because some patients may have some illness which results in acute kidney disease. They may require dialysis, and some patients may need dialysis for no more than a week or 2 or 3 or something, and then they are okay. The National Health Insurance Scheme, it covers for about 6 dialysis sessions. So for those patients, that could be harmful. But a patient with chronic kidney disease, as far as I'm aware, there is no scheme that sufficiently covers it.
It's quite.
And then transplantation itself might cost well over 10 million naira for the immediate period of transplantation.
You have to get
And then
donor, for example.
if one needs to get a donor who by law should be someone who is willing to give the kidney, usually somebody who is related to the ill patient. There should be no form of coercion, and indeed it can offend for kidneys to be sold, because it's been reported in the past that in such
practices.
practices.
Okay, so it's the ethics of the profession and the law is guarantee or ensure that whoever is donating has given his or her consent, his of age, and there are no other hindrances to donating kidney. Okay, thank you very much, Professor Kadiri. I think we've learned a lot from you on the issue of chronic kidney diseases. Just one last thing. Now, what advice would you give to the general public? One, to try to prevent kidney diseases or chronic kidney disorders for that matter.
One, regular checks, that's very important, so that even if it's present, even if the chronic kidney disease is present, it can be detected at an early stage and effective treatment given at that stage to slow down the progression of the disease. In terms of prevention of hypertension, diabetes will go a long way. And also prevention of those diseases that I mentioned earlier on. Taking care of infections generally, promptly, would also go in a way to help. Preventing extreme forms of obesity would also go a long way in helping.
So healthy lifestyle is important.
Healthy lifestyle. There are many pollutants in the atmosphere, some of which are becoming known as triggers of kidney disease. There are quite a number. Even excessive heat in the environment is a well-known cause of chronic kidney disease in some parts of the world. Although figures in Nigeria are not readily available, it just might be a contributory factor to chronic disease.
Okay. So environmental pollution, lead poisoning, heavy metals, other heavy metal poisoning, and so on. So basically, the environment should be such that does not contribute to onset of kidney disease.
That's right.
Okay, so thank you very much, Prof. I think we've had a nice education from you on chronic kidney disorders. Viewers out there, I hope you have gained a thing or two about chronic kidney disorders, and most importantly, I could say on this program, prevention. Prevention is the best form of therapy. Prevention, indeed, is better than care. Thank you very much for listening, watching us. Please do subscribe to this channel, and we'll be willing to supply you with all our episodes as soon as they are available. Thank you. Bye for now.
Optimum Health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a power. powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. We thrive, we shine with every routine. Optimum health, you know what I mean. Optimum